Hi everyone, Max Simon here from Green Flower, and welcome to another live class. If you're new here, the purpose is to bring you the world's top cannabis experts to help you learn everything about our favorite plant. And today, we're talking about something of such incredible importance, and that's using cannabis to either wane off of prescriptions or to replace unhealthy addictions in your life, and really to understand why it works, why it can be more effective than other treatments, what the safeties and or risks are, and whether it can be right for you even in everyday things that you might be struggling with in your own life. And we're incredibly grateful to have one of my favorite people here, Amanda Reiman, who was previously with Drug Policy Alliance and is now the community manager at Flowcana. She is an unbelievable wealth of knowledge and background and history and research in the cannabis space. Absolutely one of the shining lights of bringing this plant out of the dark and into the light. So please welcome Amanda to the stage. Good to be with you, my friend.
Thank you, Max.
All right, they're all yours.
All right, thank you. Well, thank you so much for joining me today. It's a real pleasure for me to be here to be talking with you about the topic of using cannabis to help break unhealthy habits. Now, if we all think for just a minute, we can probably think of a habit that maybe we wish we didn't have. Whether that's watching too much television, maybe having one too many glasses of wine on a Friday night, maybe having that third, fourth, or fifth cookie. And now think about times when you've really motivated yourself to change these habits, where you've said, Monday morning, things are going to be different. After the holidays, things are going to be different. Only to find that you're back with the same old habits you had before, feeling dejected, feeling like maybe you failed yourself. Well, I'm here to say maybe there's a whole different way that we should be thinking about behavior change, and that maybe this new way is tied to something we can all already do, which is gaining mindfulness over our behaviors and what motivates them. If you think about the behaviors that maybe you want to change, what is motivating that behavior? It is a psychological benefit, like a feeling of stress relief or a feeling of euphoria. Is it a physiological benefit, like a reduction in pain or a reduction in withdrawal symptoms? Or maybe it's a social benefit, like having something to do when you go out with friends or feeling like you're part of the group. Whatever the reason, that reinforcement is what makes it difficult for us to change our behaviors. So this class is for anyone who's ever thought on Monday morning things are going to be different, because we're going to talk about how the cannabis plant can help bring mindfulness over our behaviors, specifically when it comes to the use of prescription drugs and the use of alcohol. So in today's class, I'm going to be sharing 4 key segments. First, why does cannabis work as a substitute anyway? And how does that happen? Then I'll talk a little bit about specifically using cannabis as a substitute for prescription drugs, and in particular pain medication. Then we'll move on to talking about cannabis as a substitute for alcohol. And finally, we'll put it all together and talk about how you can maximize the benefits of this practice, and also how you might address friends and family who may be concerned or confused over your new practice. So in section 1, we're going to talk about cannabis as a substitute. Why might this even work? So a lot of times I get asked, what's the research on cannabis and substitution? What do we know? And as many of you out there may know, the Schedule I status of cannabis makes it difficult for us to study it in controlled clinical situations where human beings are being given the actual plant. But does this mean we don't know anything about cannabis and substitution? Absolutely not. There's 3 areas of research here where we actually know quite a lot. One is the impact of medical cannabis laws on population-based research. The second is the frequency of which people are actually substituting cannabis. And the third is how patients report substitution works for them. So when we look at the population-based studies of cannabis and opiates, what we found from several journal articles published to this date is that when a state introduces a medical cannabis law, we see an effect on their opiate use. Primarily, we see states with medical cannabis laws have fewer cases of opiate dependence, fewer hospitalizations for opiate overdose, and fewer fatalities from opiate overdose as well. Now, these are population-based studies, which means they have some limitations. What we're basically looking at is a large group of people after a policy change happens. But what about these people as individuals? Do they report using cannabis as a substitute for other drugs? Well, they absolutely do. Several studies have been conducted looking at the frequency of substitution among medical cannabis patients. And something we found from multiple studies is about half the patients who are surveyed report using cannabis as a substitute for alcohol. And about 3/4 report using cannabis as a substitute for prescription drugs. Now, we know more than just the frequency in these cases. We know that among patients who are substituting, they are reporting very high satisfaction with their substitution behavior. In particular, they're reporting being able to use less opiates, less alcohol, with fewer negative side effects and less risk of dependence with cannabis. But as I mentioned, we still have more to go. What we need to do now is we need to measure the use of opiates and other drugs among people who are initiating cannabis use. And we have plans to do that. If not in the United States, then maybe someplace like Canada. So why does this work? Why would we think that cannabis may be a substitute for prescription drugs and alcohol? Well, besides just the psychoactive substitution, which I'll talk about a little later, there's actually physiological things going on in our bodies that also may help explain this effect. Like the nervous system, our bodies all have endocannabinoid systems. And like the nervous system, the endocannabinoid system is responsible for homeostasis, keeping our bodies in balance. When we're in pain or when we're in distress, our bodies are out of balance. And so our bodies release endocannabinoids that mimic the same chemicals that are in the plant in order to bind to receptors in our body and maintain that balance. We have endocannabinoid receptors located all through our bodies, with concentrations behind the eyes, in the brain, and in the gut, which explains why cannabis may be so useful for digestive disorders and other disorders such as glaucoma. So as you can see, when we bring cannabis in from the plant through phytocannabinoids, what we're actually doing is mimicking the same body process that's happening with endocannabinoids through this supplemental therapy. So now that we know a little bit more about how substitution works, let's start talking about how you can apply substitution techniques to reduce or eliminate the use of more harmful substances. So we're going to start off by talking about cannabis as a substitute for prescription pain medication. Now, why is this so important? Well, in the United States, accidental overdose from opiate-based medications has surpassed traffic accidents as the #1 cause of accidental death in the United States. Even though the US has a small percentage of the world's population, we ingest 99% of the world's hydrocodone. And we are seeing rates of opiate dependence increase at an alarming rate. So what are some of the long-term impacts of regular opiate use? Well, not only is there dependence and risk of overdose, but long-term use can negatively impact functioning of major organs. And one of the things we're seeing in society today is that younger and younger people are getting prescribed regimes of pain medication that they are supposed to take for decades. That is a concern, not only because of dependence, but because of the long-term chronic effects of opiate use. So how do the risks differ between cannabis and opiates? Well, as I mentioned, accidental overdose death is the most common cause of accidental death in the United States. And as a lot of folks know, it is not possible to fatally overdose on cannabis. So what we're really talking about is the difference between a potentially lethal drug and a non-lethal drug. Now, you could absolutely overdose on cannabis, and I want to be clear about this because sometimes people say, well, you can't overdose on cannabis, but you can. Overdosing on cannabis just means that you took more than you intended to and had a negative result. It doesn't mean that you die. It doesn't mean that you have any long-term negative physical effects. It just means you took too much. Now, the risks of what happens when you overdose are different for different substances. So while the risk of a cannabis overdose are symptoms like paranoia and anxiety, the risk of an opiate overdose is death. So on their face, cannabis is safer to ingest than opiates because of the potential for fatality. Also, looking at dependence risk. The dependence risk for opiates is much higher than the dependence risk for cannabis. It's not that there's no dependence risk for cannabis. And although we don't see physical dependence happen very often, we do see some cases of psychological dependence. However, physical dependence is a very large driver for opiates. And it's a reason why many people, even if they don't intend to, can become physically dependent on opiates over time and experience withdrawals, even if they are taking their pills as directed by a doctor. So, if people can reduce the amount of opiates they're using and substitute with cannabis, not only are we reducing the likelihood of a fatal overdose, we're also reducing the likelihood of opiate dependence. And we do have research on this. There was a study done by Donald Abrams at the University of California, San Francisco, and he looked at the ability of folks to supplement their opiate therapy with cannabis. And what he found is that when people used opiates and cannabis together, they were able to use a smaller dose of opiates, and they were able to last longer between doses. So what does this do? Well, first, it reduces the likelihood of a fatal overdose, and secondly, it reduces the likelihood of developing dependence on opiates. Also, for people that are dependent on opiates and are afraid of going through withdrawals without medication, cannabis can be a very useful medication for opiate withdrawals. If we look at some of the specific symptoms of opiate withdrawals, like nausea, tremors, trouble sleeping, irritability, cramping, these are all symptoms that are very effectively treated with cannabis. Withdrawal is one of the reasons why people do not stay abstinent from opiates, and cannabis can help folks wean themselves off opiates until they're just using cannabis or until they're using nothing, if that's their choice. Some other note about using cannabis as a substitute for opiates is that method of ingestion is important. So there's different ways to ingest cannabis to get different levels of pain relief. If individuals are trying to use cannabis as a substitute for a pain that comes on suddenly, then inhalation may be the best choice, as that's going to give you the fastest effect. If someone's using opiates for joint-related pain, like arthritis, then a topical may be very useful. And if somebody is using opiates for long-term pain relief throughout the day, then an edible product may be most suitable because it's going to give you sustained pain relief without having to take another dose during the day. So now that we've talked a little bit about using cannabis as a substitute for prescription drugs, let's move on to talk about the use of cannabis as a substitute for alcohol. So earlier, I spoke a bit about some of the reasons why people may find themselves dependent on a certain substance, whether that's psychological dependence, physical dependence, or social dependence. Now, unlike prescription drugs, where the risk is primarily psychological and physical dependence, drugs like alcohol also bring with them a type of social dependence. And this is especially true for people who have social anxiety. and are looking for things to do when they go out with other people to keep their hands busy, to calm them down a bit, and where alcohol has been the drug of choice for this type of treatment. But why is it important for people to know how to utilize cannabis instead of alcohol? Well, all we have to do is look at the impact that alcohol has on the public safety and interpersonal relationships in society. Auto accidents are at threat of increase, violent behavior, domestic violence, behaviors that people wouldn't do when they were sober, all related to alcohol use. We do not see these same problems with cannabis. So just in terms of public health and public safety, cannabis is a better choice for someone than alcohol. But of course, one of the barriers here, which is probably what you're thinking at home, is, well, that's all fine and good, but I just can't go to a bar and use cannabis. I really can only go to the bar and use alcohol. So what do I do when I want to go out at night? And we'll talk a little bit about that in a minute. But first, let's talk a little bit more about how the risks differ between alcohol and cannabis. So first, I mentioned the physical effects. It is absolutely possible to experience a fatal overdose from alcohol. As we mentioned, it is not possible to experience a fatal overdose from cannabis. We also see day-after effects from alcohol, such as a hangover, nausea, headache, sensitivity to light and sound. We also do not see these same effects the day after cannabis use. And as I mentioned, there's also differences in behavioral effects. So increases in domestic violence, increases in violence in general, does not occur with cannabis the way it does with alcohol. And then finally, the risk for dependence is lower. So among regular alcohol consumers, the risk of dependence is about 15%. For regular cannabis consumers, that number drops to below 9%. And again, the dependence associated with alcohol tends to be physical and tends to be more severe, at times can even be dangerous, whereas dependence on cannabis tends to be more psychologically based, with consumers not experiencing physical withdrawals when they cease their use. So what does it look like in practice to substitute cannabis for alcohol? Well, as I mentioned, the social setting becomes very important. And you know, we're very fond of saying, we're gonna regulate cannabis like alcohol, we're gonna regulate cannabis like alcohol. But let's face it, until I can go down the street to a local pub and consume cannabis just as easily as I can consume alcohol, we're not regulating it like alcohol. So one of the things we have to do is push for social consumption. We need individuals to be able to choose to consume cannabis instead of alcohol just as easily as if they were trying to consume soda instead of alcohol. And we need to be able to do that out in a social setting, because this is where individuals have the hardest time sticking to their new habits. We also need to remind folks that there's many different ways to ingest cannabis, and this is something they may want to think about, especially when substituting for alcohol. So for example, taking an edible before going out for a night of drinking may make it easier for folks to abstain from drinking through that night. Or perhaps using a vapor pen in a place where e-cigarette consumption is allowed in a legal state is another way for people to kind of stealthily use their cannabis so that they're not feeling pressure to use alcohol. And finally, be honest with the folks you're with. If you're trying to stay away from alcohol and prefer to use cannabis, let the folks you're with know that. Hopefully, they won't pressure you to use alcohol, and they'll be more accommodating of your need to stop off to the side to use your cannabis, or to use your cannabis as an edible before going out for the evening. So now that I've talked a little bit about use for prescription drugs and use for alcohol, I want to talk a bit about pulling it all together. So what does this look like? What can you do as an individual to ensure success in trying out this methodology? And how do you talk to family and friends that may not be so sure that this is the best practice? After all, in the US, we definitely live in an abstinence-based society, wink, wink. And I say wink, wink, because we talk about being drug-free, we talk about just saying no, and then we pull up to Starbucks and get our caffeine, and then we go to Walgreens and buy our cigarettes, and then we go to Safeway and buy a bunch of sugar. So for a world that wants to be drug-free, we really aren't leading by example. But that doesn't mean you're not going to face stigma, even if you tell folks that you'd rather use cannabis than a more dangerous drug like opiates or alcohol. So first, how do you know it's working? One thing I recommend to all my patients is to keep a journal. And this is for many reasons. First, remember that mindfulness thing that I mentioned at the beginning of class? Well, that's where this really comes into play. So one of the most important parts of long-lasting behavior change is mindfulness. Now, I know this is a buzzword that people throw around when they're talking about yoga, or they're talking about hiking, or they're talking about breathing deep, but it's really quite simple. All mindfulness is an awareness of what's going on in your body, of what's going on in your mind, and how that is impacting your behavior. So mindfulness can be as simple as taking a beat, taking a breath, and really thinking about what you're about to do. But see, this is where our rushed society makes this really hard. We're used to thinking so fast that a lot of times we're acting on our thoughts before we've even had time to recognize what they are. Interestingly, not only does cannabis provide psychoactive substitution for alcohol and other drugs, pain relief for those that are experiencing pain, it also brings us mindfulness. So it allows us a better feeling and perception of what's going on in our bodies and what's going on in our minds, and from there we can think about what we really want. So for example, if you're trying to use cannabis instead of alcohol, my suggestion would be the next time you're faced with that decision of cannabis or alcohol, write about how you're feeling. Take your journal out and write about the fact that right now you are faced with a decision about whether to use alcohol or whether to use cannabis. Write about which you're going to choose and why, and then write about the outcome. If you chose cannabis and things went really well, that will be a reminder to you next time that the outcome you want is right in front of you. If you use cannabis and something goes wrong, you'll know what to do differently next time. And if you decide to use alcohol instead of cannabis and end up having a bad experience, it will help be a negative reinforcer so that next time you're faced with that decision, you may be more likely to use the cannabis. It's also very helpful for consumers to learn more about what products work best for them, which methods of ingestion seem to be most effective, and what strains they prefer. But how else are you going to know if this is working? Well, think about the things that you don't like about your opiate or alcohol use. Whether that's feeling hungover the next day, whether that's getting in another fight with your significant other, whether that's the constipation that comes along with opiate use, and think about whether these things have changed now that your behavior has changed. Because there's a lot of outcomes besides whether or not someone is using substances that we can use to determine whether this is being successful. All too often in our society, we use things like tokes per day, drinks per week, pills per day to determine whether or not someone is being successful in their habits. I would challenge you to think about it a different way. Think about the person you want to be and the relationships you want to have, and then evaluate whether your current process and practice is getting you where you want to be. So how do you deal with the social stigma? Well, there's a lot of places to find the facts. And so I would really suggest just arming yourself with the best facts you can possibly have so that when people come back at you with a feeling that maybe this isn't a good idea, you have the facts to back you up. So a couple of quick resources out there that are fantastic. One is the Drug Policy Alliance at drugpolicy.org. Another is Americans for Safe Access at safeaccessnow.org. And another one is NORML at normal.org, NORML. Great resources with tons of fact sheets, articles, and other things that you can show folks when they have questions about your substitution process. So when your family and friends ask you about this and about why you're choosing to use cannabis instead of another substance, especially when that other substance is way more socially accepted than cannabis, talk from your heart. Share with them your concerns about using alcohol or using prescription drugs. Explain to them the potential fatal outcomes that can happen with those substances, and then provide them information. Tell them that you love them, that you want to be around for them, that you want to be the best you can be for them, and that if they just are patient and are willing to learn with you, they will see that in the long run, cannabis is a much better outcome, not only for them, but for you as well. So that really concludes what I have to say about substitution. I will say that I think this practice is going to become more and more accepted. So if this is something that you're doing right now and you kind of feel like you're on the fringe, you're not on the fringe, you're on the cutting edge. And a few years from now, this is going to be a common practice, and you're going to be able to tell folks about the experiences, the benefits, and the successes that you have had using cannabis as a substitute for another substance. So thank you so much for joining me today.